Okay, so have you ever thought about like all the teeny tiny things that might be lurking on like everyday surfaces?
Oh, all the time.
Right. I
Mm.
mean, we're talking about pathogens here, those microscopic agents that can, cause infections.
Yeah.
It's a world we rarely see,
Yeah.
but it's super important to understand, especially, when it comes to like staying healthy.
Absolutely.
Today, we're taking a deep dive into a presentation. It's actually titled Infection, and it was shared with us to kind of unpack the essentials
Mhm.
of infection control, especially in healthcare settings, which is, I think, really interesting.
Yeah, and it's something that's often overlooked. But it's so important because hospitals are like places where people go to heal, right? Not to pick up new infections.
Exactly. I mean, that's the last thing you want when you're already feeling under the weather.
Right.
And before we really get started, we want to give a big shout out to the London HeartbeatsZ Academy in the UK for their support in making this deep dive possible.
They're amazing.
They are. They've got over 150 courses on all sorts of topics, so if you're into learning new things, definitely check them out. You can find them on Facebook, Instagram, Spotify, and YouTube. Subscribe to their channels so you don't miss out on future deep dives like this one. Okay, so back to infection control. Let's start with the basics. What exactly is an infection?
So, an infection basically happens when an infectious agent, like a bacterium, a virus, a fungus, even a parasite, gets into a host's tissues and starts multiplying.
It's like a tiny invasion.
Exactly, like a microscopic invasion. And
Yeah.
here's the thing. Sometimes you can be infected and not even realize it?
Really?
Yeah, it's called an asymptomatic infection.
Wow. So you could be walking around feeling fine, but you've got this like microscopic party going on inside you.
Exactly. A little bit creepy when you think about it.
It is a little creepy.
And
But I mean, sometimes those infections do make themselves known, right?
oh, absolutely.
Through all sorts of like signs and symptoms.
Right. And that's when we call it a symptomatic infection. And if that infection can spread from person to person, we're talking about a communicable disease.
Like the flu
Yeah,
or a cold.
exactly.
So we've got these pathogens lurking around, but like, how do they actually spread? How do they get from one person to the next?
That's where understanding this concept of the chain of infection comes in. It's
Right.
it's really helpful because it breaks down how an infection gets transmitted. It's like a chain, literally, with 6 links. And if you break any one of those links, you can potentially stop the spread.
Okay, so let's break down those links. What's the first one?
The first one is the pathogen itself, the infectious agent.
Okay, so that's our little troublemaker.
Right.
What's next?
Next, we need a reservoir. That's basically where the pathogen lives, survives, and multiplies. It could be a person, an animal, even something in the environment, like contaminated water.
So the reservoir is like the pathogen's home base.
Exactly.
Okay, so we've got the pathogen, we've got its home base. What happens next?
Well, then the pathogen needs an escape route, right? A way to get out.
Right.
And that's the portal of exit.
The portal of exit. Okay, got it.
It's how the pathogen leaves the reservoir. Think of a cold virus escaping through a sneeze or bodily fluids.
Ooh, yuck. I'm starting to see how breaking these links is so important. Block that exit and the pathogen is trapped.
Exactly. But let's say it does escape. It needs a way to travel to a new host, and that's the mode of transmission.
The mode of transmission. So how does it travel?
Well, it could be through direct contact, like touching someone who's infected, or indirect contact, like touching something that an infected person has touched, the doorknob.
Right.
And then there's airborne transmission, where tiny droplets carrying in the pathogen just like float through the air.
So many ways to hitch a ride.
I know, right? And once it's found its ride, it needs a way into the new host. That's the portal of entry.
The portal of entry.
Yeah, which could
Wow.
be the respiratory system, like breaks in the skin, mucous membranes.
Okay, so it's found its new target. Now what?
Now we need a susceptible host. That's the person who ultimately gets infected.
Right, but I mean, not everyone is equally susceptible, right? Some people are more vulnerable than others.
Exactly. Someone with a weakened immune system, for example, is much more likely to get infected.
This chain of infection is really fascinating because it like makes you realize how many steps are involved in the spread of an infection.
And that there are so many points where we can intervene to break the chain and prevent that spread. And that's where infection control comes in.
Okay, let's dive into that. The presentation starts by talking about controlling the reservoir. What does that involve?
So controlling the reservoir is all about minimizing or even eliminating the places where pathogens can hang out.
So making those places less hospitable, right?
Exactly. And it all starts with basic hygiene. Washing your hands, keeping surfaces clean, doing laundry properly.
So kind of disrupting their comfy hideouts.
Right. And then there's asepsis, which is preventing contamination in the first place.
ASAP.
There are two levels: medical asepsis, which aims to reduce the number of pathogens, and surgical asepsis, which strives for complete elimination.
Wow, complete elimination. So it's about stopping those pathogens before they even have a chance to settle in.
Exactly.
And if they've already settled in.
Then we can use disinfection to reduce their numbers. Think of those disinfectant wipes you use on your kitchen counters.
Right, right.
Yeah.
So we're essentially waging war on these like microscopic invaders.
We are. And for situations where we need absolute certainty that all microorganisms are gone, we use sterilization.
Sterilization. That sounds serious.
It is. It's like the nuclear option in the fight against pathogens, using things like heat or radiation to completely wipe them out.
So many tools in the arsenal.
There are, and choosing the right one depends on the situation. But here's the thing, the effectiveness of these methods can be influenced by a lot of different factors.
Really? Like what?
Well, the concentration of the disinfectant, the type of pathogen you're dealing with, the temperature, even the surface area you're treating, and whether there's any, organic material present.
Organic material? Like what?
Like blood or vomit. All these things can impact how well disinfection or sterilization works.
It's not as simple as just like spraying some Lysol and calling it a day.
No, definitely not. It's a science.
Okay, the presentation mentions both physical and chemical methods for disinfection and sterilization. Let's start with the physical ones. What are those?
Those are the ones that kind of harness the power of nature, so to speak.
Okay.
Things like sunlight, heat, filtration, and radiation.
So these are more like natural ways to eliminate pathogens.
They are. Sunlight, for example, has natural disinfecting properties, like hanging your laundry out to dry in the sun.
Oh, yeah.
And heat can be used to kill pathogens. Think about boiling water. Filtration can remove them from air or water, and radiation is a very powerful tool for sterilization.
It's amazing how we can harness these natural forces. What about chemical methods?
Chemical methods involve using specific chemicals to target and destroy pathogens. And there are lots of different categories like alcohols, aldehydes, phenols, halogens, oxidizing agents.
Wow, that's a lot.
It is.
How do you know which one to use?
Choosing the right chemical method depends on a bunch of factors, like the type of pathogen, the surface you're trying to disinfect, and, of course, safety considerations.
Right, you wouldn't use the same chemical to clean a surgical instrument as you would to, wipe down your kitchen counter.
Exactly. Different tools for different jobs.
Okay, so we've talked about controlling the reservoir, those places where pathogens like to hang out. What's next in our mission to break this chain of infection?
Next, we've got to focus on preventing transmission.
Preventing transmission.
Okay. This is where healthcare workers play a really crucial role. They use a lot of different techniques to, stop those pathogens in their tracks.
Okay, let's hear about these techniques.
One of the simplest but most effective is covering coughs and sneezes.
Oh, yeah, absolutely.
Prevents those respiratory droplets, which can be full of pathogens, from spreading.
It's amazing how such a simple thing can have such a big impact.
I know, right? And another one is avoiding sharing personal items, like utensils, towels, toothbrushes, anything that could potentially harbor pathogens.
So sharing isn't always caring?
Nope, not when it comes to pathogens.
What else?
Proper handling of soiled linens and equipment is also really important.
Soiled linens, like sheets and towels from a hospital bed?
Yeah, things like that.
Okay, got it.
These things can be teeming with pathogens, so they need to be handled carefully to prevent contamination.
So there's a whole protocol for that.
There is.
Okay, what's next?
And now, drumroll please, the champion of infection control, the MVP of preventing transmission, hand hygiene.
I knew it! I've heard so much about how important hand washing is.
It really is the single most effective way to prevent the spread of infection.
Okay, but I usually just use hand sanitizer. Is that enough?
Alcohol-based hand sanitizers are great if your hands aren't visibly dirty. They're really effective at killing a lot of pathogens. But when your hands are visibly soiled, especially with bodily fluids, washing with soap and water is a must.
Okay, so soap and water are the heavy hitters when things get messy.
Exactly. And there are certain situations where hand hygiene is absolutely critical, even if your hands don't look dirty.
Really? When?
Well, after you've had contact with a patient's skin, for example, even if it looks healthy.
Really? I thought skin acted as a barrier.
It does, but even healthy skin can harbor pathogens. So hand hygiene is essential after any contact with a patient's skin, as well as when you're moving between different parts of a patient's body, before caring for someone with a weakened immune system, before inserting any kind of medical device, and after removing gloves.
Wow, so it's like a constant thing.
Yeah.
Healthcare workers must be washing their hands constantly.
They do. It's for their protection and the safety of their patients.
So hand hygiene is truly a cornerstone of infection control. It's really amazing how much thought and effort goes into preventing these microscopic invaders from causing harm. What other protective measures are there?
Well, another one is maintaining the integrity of the skin and mucous membranes.
What does that mean?
Think of those as your frontline barriers against infection. Any breaks in those barriers, like cuts, scrapes, even dryness, can let those pathogens in.
So healthy skin is really important.
It is. And proper positioning of patients is also important to prevent pressure ulcers, which can get infected. And we can't forget good oral hygiene.
Brushing and flossing.
Yes. It's
Oh.
not just about a sparkling smile. It's about preventing oral infections, which can spread to other parts of the body.
So taking care of our mouths is part of infection control.
It is. And then there's the careful handling of drainage receptacles.
Drainage receptacles.
You know, those containers that collect fluids from wounds or surgeries?
Oh, right.
Those need to be opened as infrequently as possible to minimize the spread of pathogens.
I can imagine those things are full of those tiny invaders we've been talking about.
They can be. And when it comes to surgical wounds, meticulous care is essential to prevent infection.
So keeping those wounds clean and dressed properly is, like, super important.
Absolutely.
Got it.
And then there are isolation precautions, which are used to separate patients with contagious diseases from others.
Like isolation rooms.
Exactly. Think of it as a way to contain those highly contagious pathogens. There are different types depending on how the pathogen spreads.
Okay.
And for patients who are particularly vulnerable, like those with weakened immune systems, hospitals might create protective environments.
Like special rooms with filtered air.
Yes, things like that.
Wow.
And there are lots of other practices like safe handling of lab specimens, routine cleaning, proper gloving techniques.
It sounds like a massive effort.
It is. It takes a whole team.
So we've covered a lot of ground here in this first part of our deep dive, but there's so much more to learn. We'll be right back with part 2 to delve even deeper into this fascinating world of infection control.
You know, before we jumped into all the specifics of breaking that chain of infection, you mentioned that hospitals are places where people go to heal, not to get sicker.
Right.
And it made me realize that infection control isn't just about these technical procedures.
Oh, no.
It's really about creating that safe and healing environment.
It is. It's about recognizing that patients are often at their most vulnerable when they're in a healthcare setting, right?
Exactly.
Their bodies might be weakened by illness or injury. Their immune systems might be compromised.
Yeah.
So creating a space that minimizes the risk of infection is just so important.
Absolutely. It's paramount.
It's about giving those patients the best possible chance to recover.
Exactly. And the presentation we're looking at does such a good job of highlighting that connection between safety and well-being. You know, it goes beyond just list of techniques.
Right.
And it really digs into those underlying principles.
I love that. Now, I'm curious, does the presentation mention any specific research that supports these principles?
It does. There's a section called Research Spotlight
Oh, cool.
that highlights a study that looked at infection control practices for what they call interventional techniques.
Interventional technique.
Yeah, these are procedures where instruments are inserted into the body, like
Okay.
biopsies or placing catheters.
Oh, wow. So those sound like procedures that carry a pretty high risk of infection.
If they're not done properly, absolutely.
Right.
And the research found that even a small breach in sterile technique during these procedures
Okay.
can lead to serious infections,
Oh, wow.
even life-threatening ones.
That's a good reminder of just how important it is to be really meticulous.
It really is. And it just reinforces that point.
Yeah.
That
Yeah.
even seemingly small lapses in protocol can have huge consequences.
It's not just about knowing the steps. It's about executing them flawlessly every time.
Every single time.
Wow. Okay, so back to the presentation. What comes next?
Well, after that research spotlight, it shifts gears a bit
Okay.
to focus on patient safety and biomedical waste management.
Waste management. Huh.
You-
Okay. That might not sound as exciting as some of the other topics we've discussed,
Right.
but I have a feeling it's just as important.
You are 100% right. Biomedical waste management is a critical part of patient safety
Okay.
and environmental protection. It's
Yeah.
all about handling waste that's generated in the healthcare settings in a way that minimizes the risk of infection and protects both people and the environment.
So what does that involve? I imagine hospitals generate a lot of different types of waste.
Oh, they do. And not all waste is created equal.
Right.
The presentation talks about segregating the waste into different categories,
Okay.
each with its own specific handling requirements.
Can you give us some examples of those categories?
Sure, one category is sharps waste, which includes things like needles, scalpels, broken glass.
Oh,
These items pose a big risk of needle stick injuries, which can transmit bloodborne pathogens, like HIV.
exactly. HIV, hepatitis B.
So there are specific protocols for handling this type of waste.
Oh, absolutely. Sharps containers are designed to be puncture resistant
Oh, okay.
and leak proof to prevent injuries. And healthcare workers are trained to never recap needles
Right.
or handle sharps carelessly.
That makes sense. It's all about minimizing the risk of exposure.
Exactly.
Yeah.
What other categories are there?
Yeah, what else?
Well, another category is human anatomical waste,
Okay.
which includes things like tissues and organs that are removed during surgery.
Okay.
This waste needs to be handled with extreme care to prevent the spread of infection,
Yeah,
but also with sensitivity and respect.
that's a really good point. It's not just
So-
about safety, but also ethical considerations.
Exactly. And then there's infectious waste,
Okay.
which includes anything that's been contaminated with blood or other bodily fluids,
Like bandages.
bandages, dressings, gloves.
Got it.
This waste needs to be treated to kill any pathogens before it can be disposed of.
So it's not just about tossing things in the trash.
No, it's about a whole system for handling these potentially hazardous materials.
Exactly. And it's a system that requires a lot of planning
Yeah.
and coordination to make sure that every step from segregation to collection to disposal is done safely and responsibly.
Wow. It's incredible how much thought goes into something that we often take for granted, like waste disposal.
I know, right?
What else does the presentation cover in this section on patient safety?
Well, it moves on to the crucial role of personal protective equipment, or PPE, for healthcare workers.
PPE. Those masks and gloves and gowns
Exactly.
that we always see healthcare workers wearing.
PPE acts as a barrier between healthcare workers and potentially infectious materials.
It's their first line of defense.
It is. It's like suiting up for battle.
In the war against infection.
They got it. And choosing the right PPE for the situation is so important.
Yeah, I bet.
The presentation talks about different types.
Like what?
Well, there are goggles to protect the eyes, masks to protect the nose and mouth gowns, to protect clothing, shoe covers to protect shoes, and of course, gloves to protect the hands.
It's like a whole science,
It is.
figuring out what to wear.
There are specific guidelines and protocols based on the type of patient interaction, the potential for exposure to bodily fluids, and the risk of airborne transmission.
It's not just about throwing on any old mask and gloves.
Nope.
It's about a carefully thought out approach.
It is. And using PPE properly isn't just about protecting the healthcare workers.
Right.
It's also about protecting the patients.
Oh, right, because healthcare workers could unknowingly carry pathogens from one patient to another.
Exactly, if they're not careful.
That's a really good point. It's about protecting everyone.
Everyone. And that leads us to another crucial aspect of patient safety that the presentation highlights: sharps safety.
Right, we talked about sharps waste earlier.
Yes.
But this is about preventing those needle stick injuries in the first place, right?
Yeah, sharps injuries are a big concern in healthcare settings because they can transmit those bloodborne pathogens so efficiently.
Right.
So the presentation emphasizes using safety-engineered sharps devices whenever possible.
What are safety engineered sharps devices?
They're basically needles and other sharp instruments that have built-in safety features
Okay.
to reduce the risk of accidental needle sticks.
So like retractable needle.
Exactly, or needles with safety shields that cover the sharp point after use.
Oh, that's smart.
Yeah, it's designing those tools with safety in mind from the very beginning.
I like that. And along with using those safer devices, healthcare workers are trained to dispose of sharps immediately
Immediately.
after use in those designated containers.
Right, no recapping needles or leaving them lying around.
Absolutely not. It sounds like sharp safety is a combination of smart design and really careful practices.
It is. And when a sharps injury does happen, there are very specific protocols to follow
Okay.
to minimize the risk of infection.
So what are those?
Well, it might involve immediate wound care testing for bloodborne pathogens and even something called post-exposure prophylaxis.
Post-exposure prophylaxis, what's that?
It's a course of medications that can help prevent infection after a potential exposure.
Oh, wow. So it's like a safety net.
It is.
Wow, it's incredible how much thought goes into every aspect of infection control.
I know, it's fascinating.
So we've covered sharp safety. What else does the presentation talk about?
Well, it goes on to discuss environmental safety measures within the healthcare setting.
Okay, so now we're moving beyond those specific procedures.
Right.
And thinking about the bigger picture, like the actual environment where care is delivered.
Exactly. The presentation emphasizes that a safe environment isn't just about preventing infections.
Right.
It's about preventing other types of harm, too.
Like what kinds of harm?
Things like falls, medication errors, exposure to radiation or chemicals, even fires.
So it's really about creating a space that minimizes all kinds of risks.
To both patients and healthcare workers.
Absolutely.
So,
Wow, that's a lot to consider. What are some examples of the measures that hospitals take to create this safe environment?
well, one simple but important measure is using bed rails to prevent patients from falling out of bed.
Oh, yeah, that makes sense.
It seems obvious, but in a busy hospital environment, it's easy to overlook these little details.
Especially if a patient is confused or disoriented.
Yeah,
What-
exactly. Another basic but crucial measure is maintaining dry floors to prevent slips and falls.
Right?
Spills happen, so having procedures in place to clean them up quickly is essential.
I can see how something as simple as a wet floor could have serious consequences.
It definitely could. The presentation also talks about securing wheelchairs and stretchers properly,
Oh, right.
so they don't roll away unexpectedly.
That could cause quite a commotion.
It could, and potentially injure someone. And then there's the importance of regularly checking equipment
Oh, yeah.
and make sure everything is in good working order.
That's smart.
Faulty equipment can pose a risk to both patients and staff.
So it's about preventative maintenance.
Exactly, catching those potential problems before they become real problems.
I like that.
For healthcare workers, proper body mechanics are essential.
Oh, right, to prevent injuries.
Yes, especially back injuries, which are unfortunately quite common in this field,
So lifting and moving patients safely.
is a big part of creating a safe environment.
Right.
And finally, restricting smoking
Oh, virtually.
within the healthcare environment is essential to protect everyone from secondhand smoke.
Right. So it's about creating a smoke-free space for healing.
Exactly. These are just a few examples of the many environmental safety measures that hospitals put in place
It's
to
amazing.
create a safer, more supportive space for everyone.
This is so fascinating. It's incredible how much thought and planning goes into creating a truly safe environment in healthcare settings.
It really does. And it speaks to the commitment of those healthcare professionals
Yeah.
to not only treat illness and injury, but to prevent further harm.
It's a holistic approach to healthcare, recognizing that safety and well-being are intertwined.
Exactly. And that brings us to another important area that the presentation covers: medication safety.
Medication safety. Oh, wow. That sounds like a huge topic in itself.
It is, but the presentation does a great job of distilling it down to some key principles.
Okay.
It starts by emphasizing accurate medication measurement.
So getting the dosage right is crucial.
Absolutely. Even a small error can have big consequences,
Wow.
especially for certain medications. The presentation also mentions checking and double-checking medication orders, verifying patient identities before administering medication, and being aware of potential drug interactions.
Checks and balances.
There are. It's all about preventing errors. And the presentation also talks about storing medications properly and discarding expired drugs.
That makes sense. Expired drugs can be dangerous.
They can. And proper medication disposal is also important for the environment.
So medication safety is about protecting both patients and the environment.
It is. And it's an area where everyone involved in healthcare, from doctors and pharmacists to nurses and patients themselves, has a role to play.
It's about shared responsibility for safety. What else does the presentation cover?
Well, it goes on to discuss two other important areas of safety: radiation safety and fire and chemical safety.
Okay, so now we're moving into some more hazardous territory.
We are, but the presentation emphasizes that with the right precautions, these hazards can be managed effectively.
Let's start with radiation safety. What are the key points there?
Radiation is a really powerful tool used in healthcare for diagnosis and treatment,
Right,
but it also carries risks if it's not handled properly.
of course.
So the presentation really stresses having trained personnel handle radiation equipment and following those strict safety protocols.
So not just anyone can operate an X-ray machine.
Definitely not. It requires specialized training. The presentation also mentions labeling hazardous areas where radiation is used, monitoring for signs of radiation injury, and restricting access to those radiation
Right,
zones.
to protect people who don't need to be exposed?
Exactly. It's a whole system to ensure that radiation is used safely and responsibly.
And that makes sense.
Okay.
Okay, what about fire and chemical safety? What are the key considerations there?
The presentation emphasizes the importance of regularly monitoring and maintaining electrical equipment.
Okay, to prevent fires.
Exactly. Faulty wiring or overloaded circuits can be a fire hazard, so those regular inspections are crucial.
That makes sense. What about chemicals?
Well, hospitals use a wide range of chemicals, some of which are flammable or corrosive.
Right.
So the presentation stresses proper storage and labeling of those chemicals, as well as having procedures in place for handling spills and exposures.
So it's about knowing the risks associated with each chemical
Yes.
and having a plan in place to manage those risks.
Exactly. And it's also about training staff on how to handle chemicals safely and what to do in an emergency.
Sounds like a multifaceted approach to safety.
It is, and it involves everyone from the people who order and store the chemicals to the people who use them every day.
This is incredible.
Ah.
We've gone from those tiny invisible pathogens to the entire healthcare environment, covering this huge array of safety measures.
It really highlights how complex and how important it is to create a truly safe and healing environment.
Yeah, and it's a testament to the commitment of all those healthcare professionals
It is.
to not only treat illness and injury, but to prevent further harm.
Exactly. It's a holistic approach to healthcare,
Yeah.
recognizing that safety and well-being go hand in hand.
They do. And that brings us to another important area that the presentation covers, medication safety.
Medication safety, yes, that's a big one.
It is. But the presentation does a good job of boiling it down to some key principles.
It does. It starts by emphasizing the importance of accurate medication measurement.
So getting the dosage right is crucial,
It's absolutely crucial. Even a small error in dosage can have huge consequences.
especially for certain medications.
Exactly. The presentation also mentions checking and double-checking medication orders, verifying patient identities before administering medication, and being aware of potential drug interactions.
It's amazing all those checks and balances that are in place.
It's all about preventing errors. And the presentation also talks about storing medications properly and discarding expired drugs.
Right, because expired drugs can lose their potency or become harmful.
Exactly. And proper medication disposal is also important for protecting the environment.
So medication safety is about protecting patients and the environment.
It is. It's a shared responsibility.
What else does the presentation cover?
Well, it goes on to discuss two other important areas of safety: radiation safety and fire, and chemical safety.
Okay, so now we're really getting into some potentially hazardous areas.
We are. But the presentation emphasizes that with proper precautions, these hazards can be managed.
Let's start with radiation safety. What are the key points there?
Well, radiation is a powerful tool in healthcare. It's
Yeah.
used for diagnosis and treatment.
X-rays and things like that? Yeah.
Exactly. But it also carries risks if it's not handled properly. So the presentation stresses the importance of having trained personnel handle radiation equipment and following those strict safety protocols.
So not just anyone can operate an X-ray machine.
Exactly. It requires specialized training and certification. And the presentation also mentions labeling hazardous areas where radiation is used, monitoring for any signs of radiation injury, and restricting access to those radiation zones.
Right, to protect anyone who doesn't need to be exposed.
Exactly. It's all about ensuring that radiation is used safely and responsibly.
That makes sense. Okay, what about fire and chemical safety? What are the main things to keep in mind there?
The presentation emphasizes regular monitoring and maintenance of electrical equipment to prevent fires. Faulty wiring or overloaded circuits can be a fire hazard, so those regular inspections are really important.
That makes sense. What about chemicals?
Well, hospitals use a wide range of chemicals, some of which are flammable or corrosive.
Right.
So the presentation stresses proper storage and labeling of chemicals, having procedures for handling spills and exposures, and training staff on how to handle those chemicals safely.
And what to do in case of an emergency?
Exactly. It's a multifaceted approach to safety that involves everyone.
This has been such an eye-opening conversation. It's amazing how much thought and planning goes into creating a safe environment in healthcare settings,
It really is a testament to the commitment of those healthcare professionals.
and a great reminder that safety is everyone's responsibility.
Absolutely. From healthcare workers to patients to visitors, we all have a role to play in creating a safe and healthy environment.
This has been a really informative deep dive into infection control, and safety. But before we wrap up, I want to pause for a moment and reflect on something you said earlier. You mentioned that hospitals are places where people go to heal, not to get sicker. It's such a powerful reminder that infection control isn't just about those technical procedures. It's
Mhm.
about creating this culture of safety and well-being,
Absolutely. It's about recognizing that every patient deserves to be cared for in an environment that prioritizes their health and safety.
and that every healthcare worker deserves to work in an environment that protects them from harm.
Exactly. It's a shared commitment to safety that benefits everyone.
This has been a really insightful conversation, and I'm excited to hear what else the presentation covers. We'll be back with the final part of our deep dive after a short break. Welcome back to our deep dive into infection control and safety. It's been a fascinating journey so far.
It really has, and I'm glad we took that moment to reflect on the human side of all this.
Right, because it's easy to get lost in all the technical details.
It is.
But at the end of the day, it's about protecting people.
Absolutely.
And speaking of protecting people, this presentation actually touches on something I find super interesting. It talks about our own internal defenses against infection.
You mean our immune system?
Exactly, the immune system. I've always been amazed by how it works to keep us healthy.
It's a remarkable system for sure.
It is. And while this presentation doesn't go super deep into immunology, it does highlight a few key points.
It does.
So what are some of those key points?
Well, it starts by emphasizing the importance of maintaining the integrity of our skin and mucous membranes.
Right, we talked about that earlier.
We did.
About how breaks in the skin can create entry points for pathogens. But how does that relate to our immune system?
Well, think of your skin and mucous membranes as the first line of defense in this battle against infection.
Yeah.
They act as a physical barrier, keeping those pathogens from getting inside.
Like a wall protecting a castle.
Exactly. A well-maintained wall. And just like a well-maintained wall is better at keeping out invaders, healthy skin and mucous membranes are crucial for preventing infection.
That makes sense. But what if that wall is breached? Like, if you get a cut or a scrape.
Then your immune system kicks into gear,
Okay.
sends out its troops, so to speak, to fight off those invaders.
So there's like an internal army always on alert.
Exactly. And that army is made up of all sorts of specialized cells and proteins that work together to identify and destroy those pathogens.
I know there are different types of white blood cells, like neutrophils and macrophages. What do they do?
So neutrophils are like the first responders. They rush to the site of infection to engulf and destroy those pathogens. And macrophages are the cleanup crew. They mop up any debris.
So it's a coordinated effort.
It is a very coordinated effort. And then you have lymphocytes, which are involved in a more targeted immune response.
Right. Like T cells and B cells.
Exactly. T cells are like the assassins. They directly attack infected cells.
Wow.
Or help to coordinate the immune response. And B cells produce antibodies,
Antibodies.
which are like these guided missiles that target specific pathogens.
It's amazing how sophisticated our immune system is, and I'm guessing vaccinations play a role in all of this.
They do. Vaccinations essentially train your immune system to recognize and fight off specific pathogens before you even encounter them.
So it's like giving your immune system a preview of the enemy.
Exactly. Vaccines expose your immune system to a weakened or inactivated form of the pathogen, so you get the immune response without actually getting sick.
That's incredible. So your immune system develops a memory of that pathogen.
Yes, so if you ever encounter the real thing, your body knows exactly what to do.
It's like giving your immune system a cheat sheet for the battle.
Exactly.
It's incredible how we can harness the power of our own immune system to protect ourselves from disease.
It is. It's a testament to the power of science and human ingenuity, and it really highlights the interconnectedness of everything we've talked about today. Infection control isn't just about those external measures,
Right.
like hand hygiene and PPE.
It's about supporting our own internal defenses as well,
Absolutely. It's about creating a multi-layered approach to protection.
from the outside in.
Exactly.
Well, this has been such an eye-opening deep dive. I feel like I've learned so much about infection control and safety, from those external measures to the amazing internal defenses we have within our own bodies.
It's a fascinating field, and I'm glad we could explore it together today.
Me too. And I have to say, I feel much more knowledgeable about infection control now. It's definitely something I'll be thinking about more in my own life.
I think that's great. Remember, the knowledge you've gained today isn't just for healthcare settings. It's applicable to everyday life.
Exactly. From washing our hands properly to getting vaccinated to just being aware of potential sources of infection, there's so much we can all do to protect ourselves and those around us.
I completely agree.
Well, this has been an incredible deep dive into the world of infection control and safety. Thank you so much for joining us on this journey.
It's been my pleasure.
And to our listeners, stay curious, stay informed, and stay safe.